Good morning, everyone. I'd like to call the meeting to order. The first item on the agenda is the review and approval of the minutes from the July 29th, 2022 Board of Health meeting. Do I have a motion to approve?
So moved.
I'll second.
Okay. All in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting minutes are approved. The next item on the agenda is review and discuss the Shrewsbury Board of Health mask advisory, and this is here just to kind of reiterate what we've been doing for the past few weeks to recommending the wearing of masks indoors, especially in crowded areas. I think there's no reason to make any changes to that, right?
No.
Okay.
And Dr. Hirsch is here. He can comment as well. But
No, I would certainly support continuing that advisory, yeah.
Okay, thank you, Dr. Hirsch, Dr. Abraham. The next item is review and discuss coronavirus COVID-19 update. So I guess, Dr. Hirsch, if you have any words of wisdom today?
Well, I don't know how wise they are, but I'll try to give you what I know. And I know Dr. Abraham knows this just as well, if not better than I do. So we're in a funny place with COVID, the BA.5 variant.
Oh.
we lose him.
Has affected people who have been totally vaccinated, even totally boosterized. It has evaded some of the immunity that the vaccine has provided, and it has evaded some of the immunity that having had COVID before has provided. And we're starting to see that it can reinfect people in the short time after your initial COVID bout with BA.5. You can get it within the next 4 to 6 weeks again. And people are incredulous about this because I just went through this. I can't have another cold and test positive, but they do. Mm-hmm. And the other phenomenon that we're seeing is that many of the folks that felt they were high enough risk to need to take Paxlovid or having significant symptoms enough to have Paxlovid offered to them by their primary care docs have had a rebound thing where they go through the Paxlovid, they go through about 10 days of feeling well, they retest, they do okay for a few days, and then they're suddenly feeling worse and have a rebound case. That's what happened to President Biden and now to his wife, Jill Biden. It's been a little bit hard to kind of figure out where the numbers are because so much of the testing now is being done at home with the rapid antigen testing. But according to the numbers that are going to come out in our press release today from the Department of Public Health in Worcester, the numbers are slightly up, probably about a 15% increase in the inpatient numbers. At the same time, the wastewater numbers are down. So it's kind of a little bit confusing to say where we are, but we do know that it's still out there. And I guess our biggest concern with this particular wave is that there's still a big block of young children between the ages of 6 months and 11 years old, and a large number of unboosterized older people that is going to give the possibility of a bigger uptick, especially once school starts, which it is starting, I guess, for a lot of the school systems now in the next week or two, and in the colleges as well. So I think September is going to be a very interesting month because this is a very transmissible variant, and it seems to be easy to reinfect kids. If they've had it over the summer, they can get it again. So we've been engaged in a lot of talks with HECMA, which is the higher education consortium of the 11 colleges in the central Mass area. Their health services for students is going to be very, very vigilant. They're not going to have as strict isolation or at least a quarantining policy, because that was lifted by the CDC, you know, saying that if you've been a close contact and you're not symptomatic, it just says, you know, live your life, etc., unless you become symptomatic. That may become something that gets reversed if we see a huge uptick in the next, you know, 2 to 3 weeks. So I wish I had better news. I mean, it sounds like the CDC kind of said this is now endemic, not pandemic. It's something that we're going to have to live with, like the flu. The FDA is considering now an Omicron variant version of the vaccine, and allegedly in the first week or two of September, the approval will come for this new booster that they're going to recommend that people over the age of 60, people with immune compromise, diabetes, obesity, lung disease, cardiovascular disease try to get. I don't know how widely available the vaccination for this booster will be, but certainly it's going to be our recommendation that those groups try to get this one. It's been tailored. It's multivalent, meaning it has different immune functions to it. So it's good for the original SARS-CoV-2, COVID-19 variant. It's also good for BA4 and BA5. So that would be a great adjunct, particularly if you're one of those high-risk people. And I think that's where I will stop. It's not a clear path forward, but I think that we are going to see an uptick in September. I don't know how much of an uptick, and everyone feels like there is going to be some kind of winter surge, because that seems to be where it all starts. I mean, we had the original surge in cold weather in March of 2020, and then we had the Omicron surge in 2021 winter. And I think when that happens, if people have been adequately boosterized, they'll have a good chance of not necessarily avoiding the virus, but at least avoiding hospitalizations, ICU admissions, and hopefully the death count will be much lower.
Okay, thank you, Dr. Hirsch. Will this new booster be available to all those who are vaccinated and either once or twice boosted?
Yes.
Yes.
Okay.
I think that the recommendation will be like, if you haven't finished your booster sequence, that you should use this new booster instead of the original booster schedule. Mm-hmm. The only thing they're recommending is that if you've had COVID over the summer with BA5, presumably BA5, you should wait a good 3 to 6 months before you get this booster.
Okay, thank you. Dr. Abraham, do you have any comment or questions?
No, I concur with Dr. Hirsch's concerns. And Dr. Hirsch, I don't know how much of the inpatient volume is secondary COVID being diagnosed in people admitted for other reasons or vice versa, and primarily we're not seeing that many who coming in for primarily COVID, but have all our patients get screened for COVID as patients at UMass do. And so we do pick up positives for that reason, where we are able to isolate and keep our employees. And the rest, as Dr. Hirsch said, I believe the recommendation for people who've had COVID to defer the new booster coming out is could, not mandatory, just so that to allow people who are more eligible to get it first, just because there'll be a rush to it. But I couldn't agree more with him that everyone should get the new booster, not the existing ones, because this is specifically reformulated And it's my understanding Pfizer is filing with the FDA for 12 and older and Moderna for 18 and older to get the single-dose booster, which has both the original strain as well as the subvariant. There's already a subvariant of BA4 called BA.4.6. So there are these subvariants which will keep circulating because there is always circulating virus. So the skeptics are always concerned by the time this booster is essentially received or adopted by the community, we'll have some new variant which we may not cover, which is why the original variant, the original virus is still, the FDA required that be kept as part of the vaccine, because we don't want this to be just isolated only against one small variant, which case then we might miss the window of still boosting people's immunity to the original virus. But other than that, everything that he said, I think we share. The reason we are all still masked in public is primarily for the same reason. I think masking has its value. And clearly, as a respiratory illness, this winter may be no different than last year. Hopefully, we'll be able to blunt the effect and not have the whole Omicron surge equivalent that we had last year, and so less. And Dr. Hirsch is correct. We have seen people within a month of having had Omicron getting reinfected again. So very transient immunity, granted mild disease, but very transient immunity. So that is a challenge. And I think that keeps perpetuating virus in the community, unfortunately.
Could you comment on the what the severity of the illness is basically like for the BA4 and 5?
Yeah, Dr. Hirsch, do you want me to tell?
Well, by most people's accounts, it can be a bad cold, but usually not much worse than that. It starts with headache, low-grade fever, sometimes chills. Not as much of a thing with loss of sense and smell that from the original days of the COVID infection. We're not seeing that many complaints. Coughing is a part of it, and in general, some of the people just shake it off as, oh, I get seasonal allergies, or it's a summer cold, and they, as Dr. Abraham described, it may be like an incidental thing. They have to go to a wedding, they have to get on a plane, they test and they find out, oops, I'm positive. So it's fortunately not as severe. Maybe it's not as severe because people have been immunized or have had the infection before, and so they have some resistance already. But it doesn't seem to pack the punch that the original virus did. Which is good for the community, obviously.
Great, thank you. Any other comments or questions, Jenny? Or
no, not at this time.
Okay, if there's nothing further, then we will move on. And thank you, Dr. Hirsch, for coming on this morning. I really appreciate it.
While we do have Dr. Hirsch, though, I did want to raise if there's any concerns about monkeypox in the schools starting and colleges starting, and sort of what's on the radar there.
Yeah, so the overwhelming majority of cases that we're seeing of monkeypox is in the gay male community. And this is not to cast in any way any aspersions on the sexual preferences or the practices in that community, but we've been trying to be very, very forthright in warning that community that they are at the highest risk. That being said, if enough people in the community are getting monkeypox, then it can break out into the wider community. So you're seeing a lot of federal messaging. Everyone can get everyone and anyone can get monkeypox, and that's true. But in order to get monkeypox, you have to be in very, very close proximity, skin-to-skin contact with someone that has monkeypox. So it's not as likely that it's going to break out. It's not a respiratory virus. It's one that causes a flu-like syndrome, again, with large lymph nodes in the initial phase, and about 4 to 7 days after the initial phase, you break out in a rash. The rash starts out as red spots, can be anywhere in your body, but typically starts on the extremities. And then those red spots turn into little blisters. And then those blisters turn into what we call pustules. They're pus-containing blisters. And it looks quite angry and nasty. And that pus in those blisters, when they are scraped or burned, burst next to another person, that's how this thing spreads. So you have to be in very, very close proximity, or in someone who's having these pustules burst on their bed sheets, and you're the person handling those bed sheets to do the laundry, or if you're a maid in a hotel or something like that, that's how it could break out into the broader community. It has been seen in children, but the children generally have been in household situations with the previously mentioned population segment of gay men. We're not so worried about spread in the elementary schools or middle schools. I think that as the kids get older, you might see more in the high school level of this breaking out. In the colleges, there's definitely a concern. We spoke again to the HECMA group. They identify, it's hard to exactly know because it's self-reporting, but as many as 20% of college students identify themselves in the LGBTQ plus community, and there's a possibility that it could cause some outbreaks in the colleges. They are really working hard to provide a lot of information even before the students come on campus about monkeypox, and they're trying to get access in cases of outbreak to vaccine. Currently, the way the vaccine is being distributed in Worcester itself, AIDS Project Worcester is the site for vaccination. The Worcester Department of Public Health is providing some nursing support. UMass is also providing some infrastructure support. It's not, unfortunately, it's not been distributed in great enough quantities to make it very easy to get in, the short run. The reason the vaccination would be a good thing for a close contact is that obviously you would potentially blunt the kind of degree of pain and spread, but it probably wouldn't completely immunize you from getting it. But in that community where there might be people with immune compromised situations, it would be good to blunt it. The other issue is that if you did nothing, you would have a very bad month and you'd have to isolate during that month. So that's very, very difficult to, for a college student to isolate for 1 month. But the colleges are making preparations for that contingency. But once you're done, the rash, as awful as it might look in week 2 or 3, goes away and doesn't leave any scarring. And it is not a lethal situation. This is not like COVID where a certain percentage of people are going to die. This has not been seen in monkeypox, but the numbers do keep going up. And right now in Worcester, we have about 17 cases, I believe. I don't know if Dr. Abraham has more up-to-date information, but I think that was the last number that we saw.
Great, thank
Okay.
you. And do folks have lifetime immunity if they've caught it and gone through the process?
Yes. And apparently people that have had smallpox vaccination have a lower likelihood of getting it, but smallpox vaccinations haven't really been in vogue for a while. So that's why it seems to be prevalent in that age group between 18 and 30.
Great, thank you.
Okay, thank you. Anything else? Okay. Well, again, thank you, Dr. Hirsch. It was very, very informative. Thank you.
My pleasure. Thank you very much. And I hope you guys are safe and well all through September.
You too.
You too.
Have a well-deserved
Great
vacation.
vacation.
Yeah, enjoy.
Thanks very much. And I want to thank publicly, Dr. Abraham is going to be my backup at the Department of Public Health if a public face is needed. And he's got such a much nicer face than me. I'm so glad.
Dr. Hirsch, your vision needs rechecking.
Thank you.
Thank you. Take care, Doctor.
Bye.
Bye-bye.
Okay, the next item on the agenda is review and discuss the Central Mass Regional Public Health Alliance updates. And Micah, do you have your update?
Sure. We've had kind of a steady stream of housing complaints that seems to be a little bit higher than normal. So just kind of working through those. They're seeming to take multiple inspections to get all the issues resolved. Food has been pretty stable. No reports of any illnesses or anything like that, and not a lot of complaints lately. So that's about all I've got for you today.
Okay, and the food trucks are doing well?
Food trucks are doing well. We've got a nice kind of roster of a good group of food trucks, so we're encouraging event coordinators to use them. That way it's people we know and kind of trust and have inspected. So it's so far working out pretty well.
Great, thank you.
Yep.
Any other questions or comments?
I know I saw an email come through yesterday about a pool. I don't know, Carrie, do we have any updates on that or what that situation is?
Yeah, the property is in foreclosure. Micah actually did a site visit that same day the complaint came in and was met with a lot of pushback and hostility from the occupant. So he left for safety reasons. But once they are out of the property, Micah will be following up again.
Yeah, I just tried to encourage them to use the free mosquito treatments from the Central Mass Mosquito Project, but they were just already upset that they're being foreclosed on, and then were more upset that someone complained about their pool, and it was just hard to get through that it's just a simple free thing that you don't even have to be there for. So we tried.
Okay, great, thank you.
Thanks.
Any other questions, comments? No? Okay, great, thank you, Micah. So the next item is to review the meeting schedule. I will not be available on September 30th, so I could either do September 23rd or October 7th.
I'll take October 7th. I might be traveling September 23rd.
Okay,
Yep, 7th works for me.
7th, okay. Let's do that.
October 7th?
October 7th.
Okay. Thank you.
Okay, if there are no other comments, questions, do we have a motion to adjourn?
So moved?
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting is now adjourned. Thank you, everyone.
Thank you.